Hi, everyone. This is Dr. Aurelie Najm from Glasgow, reporting from Rome now. I don't know if you remember, but a few years ago, there was this study in pre-RA, the PRAIRIE study, where they looked at risk for RA individuals, giving them rituximab infusion. And then this study really made a lot of noise because some people were finding it very provocative. Actually, after one infusion on rituximab, after approximately a year, a quarter of the patients treated were delayed in the onset of their rheumatoid. And there have been a lot of debate whether or not, it was ethical and whether or not it was worth treating so many patients to just delay the disease of only 1 year. Well, now, today was presented another study, abstract 455, the ARIA study. This time they looked into abatacept and they treated individuals at risk for RA with abatacept for 6 months subcutaneously in a RCT compared to placebo. The subjects that were included in this study had to be ACPA positive, had to have arthralgia, and had to have subclinical signs of inflammation on their MRI. So you can start thinking, right, this is very close to actually clinical RA. But anyway, they've been given the treatment, and the primary endpoint of this study was the improvement of subclinical inflammation on MRI, so synovitis or tenosynovitis. And they were able to show that in 2/3 of the patients treated with abatacept, there was an improvement compared to only 1/3 of the patients that were treated with placebo. Right, this is good, but does that prevent from patients to, moving to the next step and developing clinical RA? Well, that was their secondary endpoint. And actually, they were able to show that in a 6-month period of time, only 4 patients developed RA in the abatacept group compared to 17 in the placebo group. Well, these data are interesting, but it's only 6 months follow-up. We definitely need to know if, first of all, RA onset can be delayed or even prevented. And they have 18 months data on the way. So I'm really looking forward to that. In the end, I think it's quite interesting, but it's the same thing. We really need to know what's the number of subjects to treat. Regarding the safety profile, it was pretty fine. There was no new safety signals, 12 adverse events in the abatacept group, including 1 pneumonia. So I think I'm quite looking forward for next ACR 2022 so we can get the final results. In the meantime, stay tuned with Rome Now for more rheumatology content and follow me on Twitter at Aurelie Najm.